Imagine an implant surgery with no incision, no sutures, and only a small local infiltration of anesthetic. With minimally invasive implantology, this is reality. MTech, a 3M company, invites you to enter the world of minimally invasive implantology with the MTech MDI implant system, the world's leading small diameter implant. Minimally invasive implantology is quickly becoming one of the most profitable services offered by general dentists worldwide due to clinical ease and patient satisfaction. And at the root of this revolution is the implant that started it all, the MDI implant. With over 1 million MDI implants sold worldwide, it's no secret that small diameter implants are a valid and effective treatment option. With this revolutionary system, denture patients with even severe bone resorption can enjoy implant-stabilized dentures without costly invasive surgical procedures, minimizing the intimidation and expense associated with conventional implant treatment. In this video, viewers will be introduced to the MTech MDI implant system and its minimally invasive placement technique that together are changing the lives of dentists and patients around the globe. It's an exciting journey, and it begins now. As the global leader in small diameter implants, MTech offers the broadest range of implant lengths, diameters, and thread designs, providing a complete solution for minimally invasive implant treatment. The ideal implant thread design, length, and diameter are selected through evaluation of the patient's anatomy using the combination of a panoramic X-ray and MTech's ridge mapping caliper, or utilizing a CT scan. As a leader in cone beam CT due to imaging experience in multiple industries, MTech has produced CT solutions designed to simplify treatment planning. MTech supplies an MDI radiographic template with various magnification levels for accurate selection when using a panoramic or cephalometric X-ray during treatment planning. The ideal collar design is selected through manual probing of the patient's soft tissue depth. Syndex MDI protocol requires that a minimum of 4 implants are placed to secure lower dentures and a minimum of 6 implants are placed to secure maxillary dentures. MDI implants should be positioned at least 7 mm mesial to the mental foramina and spaced at least 5 to 8 mm apart to allow enough room for the MDI metal housing attachments. MDI implants work with removable metal housing attachments with O-ring inserts that are incorporated into the patient's new or existing denture, creating an implant-retained but tissue-supported removable prosthesis. These attachments are incorporated through a chairside procedure using an innovative cold cure acrylic, MTech Hard Secure, which is absent of the unpleasant odor, taste, and heat associated with other cold cure acrylics. To prepare the patient for MDI implant placement, the mental foramina and planned implant sites are marked on the patient's tissue using MTech's sterile surgical marker. MTech's dry field system works to maintain a clean, dry, unobstructed field during MDI implant placement. Once local infiltration is administered at each implant site, taking care to anesthetize below the periosteum, the patient is prepared for the procedure. Step 1 is the creation of pilot holes at each implant site. The sterile 1.1 mm diameter MDI pilot drill is placed over each site and is used to puncture attached gingiva. For mobile mucosa, the 1.5 mm tissue punch clears the site prior to drilling. Then, with copious sterile irrigation, the drill is lightly pumped up and down at approximately 1200 RPM until perforation of the cortical plate is achieved. This completes the drilling sequence. You will notice that unlike traditional implant surgeries, a full-depth osteotomy has not been prepared. This minimally invasive process is essential to the stability and success of MDI implants. Step 2 begins with removal of the implant from the sterile vial by withdrawing the retentive vial cap. The implant can be stabilized in the pilot hole using the vial cap or the MDI finger driver. If initial advancement with the finger driver is desired, titanium locking pliers are used to transfer the implant to the retentive tip of the finger driver. After inserting the implant into the pilot hole, rotate clockwise while carefully exerting downward pressure. This initiates the self-advancing process and is used until noticeable bony resistance is encountered. Step 3 utilizes the MTech wing thumb wrench to auto-advance the MDI implant through the viscoelastic medullary bone. Use it to thread the implant into place until the wrench becomes difficult to turn and more torque is necessary. Sufficient resistance at this stage is key to long-term implant success. Though the MDI winged thumb wrench can be used to successfully complete implant placement, in extremely dense bone, the MDI ratchet wrench or torque wrench and adapter assembly may be necessary for final seating. This brings us to step 4, final seating of the MDI implant. Final seating is ideally accomplished when all blasted threads of the MDI implant are engaged in bone, which positions microthreads on collared MDI implants in the ideal location to prevent soft tissue migration and maintain crustal bone levels. For optimum success, bicortical stabilization is desired, meaning the apical tip of the implant will embed in dense cortical bone. Once final seating of each MDI implant is accomplished, you are ready for step 5, the intraoral retrofitting of the patient's denture using metal housing attachments with incorporated O-rings and MTech Secure hard pickup material. First, transfer the location of the implants to the tissue-bearing side of the denture by marking each implant head with an indelible marker or pressure-indicating paste and placing the denture on the implant heads to transfer those marks. Then use an acrylic burr to excavate a 5 or 6 millimeter relief at each implant location, allowing space for the attachments. To prevent acrylic from seeping into the undercut, always use MDI blockout shims trimmed to the appropriate length. Cover the neck of the implant, leaving the O-ball head exposed. Next, place the metal housing on each implant. Test the resiliency of each housing by pressing downward and rotating on the implant head. The blockout shim should not prevent the metal housing from fully seating. Next, MTech Secure hard pickup material is used to incorporate metal housings in the denture. Once the tissue-bearing side of the denture is roughened with an acrylic burr, a thin layer of secure adhesive is painted on the surface, providing an ideal bonding surface for the acrylic. Once the denture is primed, the material is extruded through a self-mixing tip directly into each attachment and into the patient's denture. The denture is then seated. The patient should provide normal centric occlusion for 7 to 9 minutes while the acrylic cures. Then the denture is removed, trimmed, polished, and reinserted for any necessary occlusal adjustments. For cases in which the bone quality is poor, such as in the maxilla, or cases in which bicortical stability cannot be obtained, MTech recommends using MTech Secure soft reline material without metal housings for the first 4 to 6 months after surgery. This will provide a less stressful environment during osseointegration, while still allowing the patient to enjoy enhanced stability of their prosthesis immediately. After the healing period, the silicone material can be removed, and a pickup procedure can be done with the metal housings for maximum stability. To make the Syndex MDI protocol as easy as possible to follow, MTech offers the MTech MDI Kit. This kit includes everything a clinician needs to place MTech MDI implants, plus secure hard pickup material for easy chairside denture retrofitting. Optional items not included in the kit, but very useful with the system, are MTech's ridge mapping calipers and secure soft reline material. Implants and metal housings are sold separately in order to allow clinicians the freedom to choose the ideal implant and housing combinations for their cases. Also available are impression copings, analogs, and additional lab components for indirect restorative procedures. MTech makes denture stability simple with the MDI system, and with the Solera system by MTech, denture fabrication has never been easier for the clinician and the lab. Ask your MTech representative about more profitable, predictable dentures using the Solera system. If minimally invasive implantology is not part of your practice today, ask yourself, why not? Today you've received a detailed introduction to the MTech MDI system and the patented Proven Syndex MDI treatment protocol. To advance your knowledge and confidence level for maximum success, attend any one of MTech's acclaimed MDI certification seminars where you will learn and practice MDI protocols. These courses take place in major cities year-round and are led by some of the world's most experienced and successful MDI clinicians. Visit MTech's website at www.mtech.com. Call an MTech representative today for a current complete listing of locations and dates. With the MTech MDI system, the appreciation and gratitude of so many of your patients is at your fingertips. Take your practice to the next level now with minimally invasive implantology and the MTech MDI system. We look forward to the opportunity to guide you every step of the way.